for taking a few minutes to come. My name is Craig Eddy, and I'm the Chief Medical Officer here at Northwest Healthcare. And it just gives me enormous pleasure to make a couple of announcements today. The first announcement is that we were given a 3-year accreditation by the American College of Surgeons Committee on Cancer with commendations and no contingencies. And I'm going to speak to what that means in just a second. But secondly, we also received at the same time a separate survey for our Bass Breast Center and got a 3-year full accreditation by the National Program for Breast Centers, which again is administered by the American College of Surgeons. And that also was with commendations. I guess what I would say, and then I want to get out of here because the true credit goes to Dr. Holvat and her team, and she'll introduce everyone from the team. But I've been involved with the American College of Surgeons for about 20 or 25 years, and I've actually done some accreditation work with them in trauma and other areas. And they are a very, very particular and meticulous body. And most programs don't even achieve accreditation on the first go-round. It usually takes a couple of tries to get it. And for a program to not only achieve accreditation for 2 programs, not only to achieve accreditation, but to be cited as having commendations. And the meaning of having a commendation is that when they come and they look at our program, they look and they say, this is the best practice. This is the best I've seen, and I want to take this out and share this with other areas and with other programs that are being accredited. So with that, I'm going to let Dr. Holvat talk to you about the team that did this, and then also about what some of those commendations were, and really the amazing cancer program that's been put together here in the Flathead Valley. Melissa?
Thank you all very much for coming today. To us, receiving these accreditations, especially receiving both of them at the same time, is a big deal. To us, it's like getting straight A's on our cancer care report card and making a nationwide honor roll. And this is not possible without an entire team of cancer experts who are uniquely devoted to patients. Many of them, it took a village. There are so many nurses, support staff, social workers, therapists, tumor registrars, and physicians involved in this process. But I've asked some of them here today. If you have any questions, I'll let you know who they are and what vital role they played in this process. So Dr. Pete Smith is our Director of Laboratory Medicine and a pathologist. Dr. Karen Hunt is a medical oncologist at Northwest Oncology Hematology. Dr. Debbie Wade is a breast imaging specialist, and she is my co-director at the Bass Breast Center. Dr. Ben Pomerantz is an interventional radiologist extraordinaire, and Dr. David Sheldon is a surgical oncologist and is the Montana representative to the American College of Surgeons. So none of these accreditations are possible without these people as well as others. Hiding in the corner, and who will be talking to you later, is Ms. Sandy Shaw. She's our nurse navigator for oncology care, and Kim Grinrod, who's our nurse navigator for breast cancer care. So to tell you a little bit about what the accreditation process was, the American College of Surgeons Commission on Cancer asks us to meet 36 different standards, and the new push is for these standards to be patient-centered. We have to prove that we have the latest technology and the right physicians and practitioners to administer them. But even more, we have to prove that we bring these technologies to the patient. We have to meet standards in prevention, early detection, and survivorship as well. In addition, we have to keep rigorous data through the National Cancer Database that allows us to give lifetime follow-up to our cancer patients to know how they are doing with their cancer care. 80% of cancer patients in the United States are taken care of at COC accredited facilities, but only 30% of hospitals are COC accredited, and we're proud to be one of those centers now. The National Accreditation Program for Breast Centers asks breast centers to meet 27 different standards, and we met all of those as well. Some of the things that this means to a patient is that a patient coming here to the Bass Breast Center, Kalispell Regional Medical Center, and Northwest Healthcare can anticipate that they get multidisciplinary care, which means that the physicians that you see in front of you are present at a weekly tumor board. That means that when a patient is diagnosed with cancer, 1/3 of our patients have their case presented at tumor board, where all the physicians sit around the same table and talk about pathology, radiology, treatment plans, palliative care, social work, nutrition, and other aspects of their care. 50% of our newly diagnosed breast cancer patients as well are discussed in a multidisciplinary fashion, which allows a patient to know that things are not happening in silos. They're happening all together for their benefit. It really is a team approach. Also, patients have access to prevention and early detection programs, and also through the Glacier View Research Institute Cancer, they have access to clinical trials that can often bring them newer, cutting-edge care, and many times we can have them participate in those trials here in Kalispell as opposed to having to travel. I also mentioned our cancer monitoring through the National Cancer Database, which is very important for long-term patient follow-up. But again, it's not just about having the best people and having the best technology. It's about bringing it to the patient. And I'd now like to invite Sandy Shaw, our nurse navigator for oncology care, to tell you a little bit about our patient-centered services here at Northwest Healthcare. Sandy?
Thank you. Our navigation services actually began with a breast cancer navigator. And after we saw the amazing benefits and just the success of that program, along with planning for our COC accreditation process, we identified the need for an oncology navigator. And what a navigator does is she begins the process with that individual as they're going through a potential cancer diagnosis. We provide support, we provide education. And once that diagnosis has been identified, we adjust our role as that patient adapts to their disease and provide what they need. Usually it's emotional support, as well looking at the family and how they're dealing with this process of a catastrophic disease and how it's impacting each individual in their family. So our role changes and adapts as the patient adapts to that particular entity or that where they are in their disease process. Again, we provide overall education, emotional support, resources, housing. We're very fortunate that we have apartments on site for those patients that come from the area, which is quite common. So we feel very proud of our navigation. We're learning, and we're subsequently adding more support services to it.
Thank you. So it's about having the cutting edge technology. It's about having the right people. It's about taking that technology to people. So it's not about what we have, it's about what we give, and we give it to our patients every day. And so we're very privileged to have a cancer survivor and a dear friend of ours now here today. Jan Rupp-Straight has been going through a cancer journey as we've been going through this COC journey. And we've all arrived at a good spot together, I think. And I think Jan would like to share a few words with you. Jan, if you're comfortable there or comfortable here.
Wherever you want me.
The floor is yours.
First, I would like to say I feel privileged to be part of such a distinguished panel as this and have the opportunity to tell you about the wonderful care and support I received from the staff at the Bass Breast Center after my diagnosis of breast cancer in November of 2010. The cancer specialists working at the Bass Breast Center and Kalispell Regional Medical Center, with their up-to-date knowledge base and carefully trained staff, were not only able to treat my disease, but also give my confidence a big boost with their expertise. After the scans and biopsies were completed and the information evaluated, My diagnosis was stage 3A invasive ductal carcinoma, so I experienced the full gamut of treatment. Chemotherapy after an implantable port, mastectomy with reconstruction, and radiation therapy. All these services were provided or arranged through Kalispell Regional Medical Center and the Bass Breast Center as a matter of everyday business. No extra effort required, and most conveniently, with no long-range travel involved. It was very unnerving to be told the lump I could feel in my breast was cancer, but my husband and I were soon to find out, although our world had just been turned upside down, there were people right here at home who were up to the task of ridding my body of this terrible disease. We had everything we needed and never had to drive more than 20 minutes to get it. Since much of my treatment took place during the winter months, this short travel time was a real blessing. To have cancer is a learning experience, and one of the things my husband and I learned in the last 17 months is how fortunate we are to have this highly specialized team right in our own community. When you have cancer, you automatically become interested in anyone else who is facing the same trials as you, how they are being treated, and how the treatment is working. After hearing and reading many stories about cancer patients from across the country, we feel assured that we could not have received better care or received a better result than any other facility, even the large university hospitals in the metropolitan areas. The more we learn about cancer treatment, the more we realize that cutting-edge treatment is available right here in our hometown. The Bass Breast Center staff could not have done a better job of guiding me through my treatment program. My appointments for the necessary scans and biopsies were made for me. Everything from surgery to recommendation for lymphedema treatment was handled by the staff. My many questions were answered promptly, completely, and honestly. Their disposition was always sunny, optimistic, and their confidence in each other and their program was a great comfort to me and my family. At every turn, we were advised about what the next step would entail and how my body might react. The entire staff was very much aware that cancer not only affects the patient, but their spouse and family as well, and made every effort to make sure my husband knew what was happening with my treatment. Their good cheer was appreciated as much as their expertise. If one of the national polling organizations was to travel the country asking people where the city of Kalispell is, it's a fair bet the overwhelming majority would not have heard of our little town. Lots of those people, when they found out where we are, would consider us to be isolated from the modern world. Breast cancer, though, knows just where to find us. Fortunately, for all the women who live here, the dedicated team of professionals who work at the Bass Breast Center and Kalispell Regional Medical Center found us too. To my everlasting gratitude, they not only recognized the need for a first-class cancer treatment center, they made this center happen. Thanks to them, we have unsurpassed breast cancer treatment right where it does the most good, in familiar surroundings and carried out by people who live right here in our community with us. Thank you and congratulations for a job well done.
Thank you all for coming, and I would like to open up the floor for any questions, or if you'd like to ask Dr. Smith, Dr. Hunt, Dr. Wade, Dr. Pomerantz, Dr. Sheldon, Sandy Shaw, or Kim Greenrod. I also see Dr. Lillard here, are all available for questions about elements of our cancer program. Obviously, Dr. Eddy and I would be happy to answer your questions as well. But thank you for coming and letting us share with you our exciting news about the exceptional cancer care that we provide to patients of Northwest Montana right here close to their home. Thank you. Yes.
What was the process of accreditation? What did it involve?
So accreditation means first believing that you have all the elements of excellent cancer care, but it's not enough to grade your own paper. Essentially, then we invite these organizations to come and grade our paper for us. There's an online application to both the COC and the NAPBC where we submit documentation showing that we are meeting all 36 or 27 of their standards. Then there's an on-site visit, and this is voluntary, and there's a fee associated with it if it costs us money to have them come out and look at our program. We had a surveyor on site for 2 days. He went through some de-identified charts in the tumor registry. He met with members of our team. He toured our facility. And then afterwards, a combination of the thing that was submitted online, the survey application report, as well as his assessment, goes through the American College of Surgeons, and they decide whether you achieve a 1-year accreditation, a 3-year accreditation, or a 3-year accreditation with commendation. And we were proud to get a 3-year accreditation with commendation in 6 out of 8 categories that were eligible for commendation. So that is the process.
I know this is a pretty vague question, and it's tough to compare to facilities all across the country, and I guess anybody can answer this, but where does this place KRMC with say, the Mayo Clinic and other places that deal specifically with cancer?
So the National Accreditation Program for Breast Centers is relatively new. They've only been accrediting breast programs for a few years, and it places us shoulder to shoulder with the finest institutions in our state, in our region, and in the country. There is only one level of accreditation, and if you're the Mayo Clinic, the Cleveland Clinic, or the Bass Breast Center at Kalispell Regional Medical Center, you meet the same criteria. The Commission on Cancer designates a couple of levels. There's National Cancer Institute, which are large academic medical centers with research, all the way down to community cancer centers. But we all have to meet the same standards. And so we are proud to say that Kalispell Regional Medical Center compares to the cancer programs in our region, such as St. Pat's and the Billings Clinic, as well as all the way to Spokane, Seattle, and across the country. It's not enough to say that you provide excellent care. You have to prove that you provide excellent care. And through participation in the National Cancer Database and the Commission on Cancer, we are able to prove that our care is comparable to those larger medical centers, and that our patients don't have to leave to get the finest cancer care.
And I guess a second question for anyone, again, on the board. You guys deal with cancer here in the Flathead firsthand. How many cases do we see every year? I mean, I know that there's breast cancer and all different types of cancer, but you know, is there any kind of estimate as to how much you guys deal with every year here in the Flathead?
What did we say, Melissa? 621 analytic, or a little over 800, including non-analytic, in 2011.
So Mary Romano, who's one of our tumor registrars, deals with that data every day. And yes, it's over 600 cancer cases that are diagnosed and treated here, around 800 if you consider cases that are come in and out of our region. Dr. Smith might be able to tell us a bit about the complexity of cases that we see, as they are all underneath this microscope. Do you want to take that?
Sure. This hospital and the pathology laboratory here sees an amazing array of different kinds of tumors and specimens, and because of the radiologists and the surgeons and the oncologists and their level of expertise, we see types of tumors that your typical small community hospital doesn't see. An example is there's tumors, a pancreatic cancer. One way of treating that is a very complicated surgical procedure called a Whipple procedure, which usually isn't done in a place like this. So I'm seeing specimens here that I hadn't seen since my residency days in a big university in Vermont. And so it's very unique, and it really, you really get to see lots of different specimens and types of procedures that aren't typical for a place this big. So it makes us be on our toes, and we need to really keep up to date, and it makes our job interesting. And the best part is we're able to provide usually these sort of procedures you would have to travel to Spokane or Seattle, and now we're able to do them here, so the patients don't have to have that travel as an extra burden as they're going through this process.
I think it's really important to emphasize what Dr. Smith says here. Next to me is Dr. Sheldon. At the end of the table is Dr. Lillard. They're the only two general surgery specialty trained cancer surgeons in the state, and much of cancer treatment is medical, but much of it is surgical. And having people who can do not only the medical treatment, but the very, very complex surgical treatment here is, we have people coming from all over the state now for Dr. Lillard and Dr. Sheldon.
I would say probably 3/5 of the patients that I operate on come from outside the valley. Bozeman, Helena, the High Line, Great Falls, Missoula.
Sydney, do you have?
All right, I think we offer the gamut of surgical procedures, generally speaking, from that are available for cancer treatment. And, I think I see probably 40% of people coming from out of the region because of what we can offer. And it's not just a surgical entity either. It's our pathologists have made great strides so that we can provide better diagnosis and accurate tissue staging so that we can then appropriately treat our patients and have Dr. Hunt and Dr. Stilley render additional treatment that are necessary for adequate management, or more than adequate, but for appropriate management of our cancer patients. So we offer the full gamut of. And Dr. Pomerantz has also brought additional specialty in terms of the ability to offer image-guided treatment as well.
Maybe you can say a little bit about the specialty that you bring.
Well, interventional radiology is a subset of diagnostic radiology. We're guys that do procedures, and it's guided by x-rays or ultrasound or CAT scan or something like that. So we're involved in not only the diagnosis but the treatment as well. We do a large number of biopsies to help get the tissue for Dr. Smith. And in patients that aren't surgical candidates or don't necessarily want surgery, we can provide very minimally invasive organ and specific therapy where we can deliver high-dose chemotherapy or radiation therapy right into the tumors, particularly in the liver. We can also treat tumors percutaneously where we put a needle in the tumor and either freeze it or cook it. So it's really a multi-specialty place that I've only been here about a year and a half, and it's very exciting to me.
Are there any cancers that you that still will go out of that you don't treat here? What would that be?
Dr. Hunt can tell us about that, I suspect.
Mostly because of the blood support problem, we send our patients with acute leukemia to other centers where they can get platelet support faster. And we also don't do stem cell or bone marrow transplants here. That requires a bigger institution, a place where they can they have other supportive services that we don't have. But otherwise, we pretty much do everything. And I mean, I think that should be emphasized, that the majority of cancers, those would be the 2% of malignancies that we see, but the 98% we can take care of.
A typical day, I'll see all sorts of cancers, anything ranging from brain tumors to melanoma of the skin, to bladder tumors, liver, pancreas, lung. My day is very interesting because you never know what we're going to get here. And we basically get everything except some of those. And some of the pediatric, we don't do a lot of pediatric.
We don't have a
cancer
pediatric oncologist here.
But other than that, pretty much everything.
Are there types of cancers you guys see prevalent here in the area?
It's a good question for our tumor registrar. I think it's pretty, you see the usual gamut and the usual percentages of what is across the United States, which would be lung, breast, prostate, and colorectal.
Common things are common.
Yep.
The reason there is a separate accreditation for breast centers and cancer programs is it is an incredibly prevalent tumor, most prevalent tumor in American women, 200,000 cases a year diagnosed. And so breast cancer is our #1 cancer diagnosis, followed by prostate, bladder, lung, colon. We also see a lot of gynecologic malignancies, cervical cancer, endometrial cancer, followed by ovarian cancer. And I think those are our top 5 plus 6 sites. So we see what everybody else sees, and we don't want our patients to have to drive somewhere else to treat something that's common.
We are seeing more pancreas here recently.
Yes, and
but
more
that's
pancreatic
because
cancer.
We now have surgeons who can take care of it.
Has this required a large investment on the part of the hospital to come to this point?
It's
Any idea what that is?
Yeah. It's required investments that are worthwhile in excellent staff, in trained medical professionals who are board certified and fellowship trained, as well as investments in equipment. Dr. Pomerantz spoke to our increasing interventional radiology capacity, and Dr. Smith was telling us about our increased lab capacity. So all of those investments are not for a cancer accreditation, they're for treating our patients. There was a fee involved with having the COC and the NAPBC come out to accredit us. That was a few $1,000s. But the major investments have been what money is put in to give our patients what they deserve. And so there has been quite a lot of investment in those arenas. I don't know, Craig, if you'd like to.
I think the major investment has been Dr. Hallvat's time. Time and effort into this program. She gets a lot of the credit for this, pulling this off.
I mean, the people in this room have invested their time, and that's been a major investment. Their time and their effort and their care. And that's what's made it a success. You put all the money you want into any kind of program, but without the people to back it up, it's not going to succeed.
And you know, you're looking at a panel of doctors at the table, but actually we could fill the room with people who helped in this effort. And a lot of them are sitting in the corner there, not getting their pictures taken, but they're the ones who did a lot of the work for getting this through.
And I think that the biggest payoff for that investment is for the people of the Flathead Valley. And it's not just the person who has cancer, it's their entire family. If you ever talk to someone who has to go and spend 6 or 12 weeks in a foreign city getting treatment, and it is so disruptive to families and support systems and people who have to work. It's just amazing, and the people of Montana have had to do that a lot. And this cancer program, I think, really gives back to the people of Montana by letting them stay home and have their care delivered by Montanans.
I have one for the patient.
Jim?
Yeah. Now, what made you decide, was it 2010, to stay here rather than go somewhere like Seattle or Spokane to your treatment?
Actually, I work at this hospital, and I know what an excellent facility it is, so there was no choice for me.
So you didn't look at other... Where do you live? In here?
Pardon?
Where do you live?
In Kalispell?
In Kalispell.
As Dr. Hunt very rightly pointed out, our tumor registrars, our cancer coordinators, some of our nursing staff and research staff are hiding in the corner. I'd also like to make available to you for questions afterwards if you'd like. Ms. Lori Hadelberg, who waved to you, is Director of Inpatient Oncology Nursing, and Judy Pfaff, sitting behind her in the lovely green jacket, is from the American Cancer Society. They know so much about making sure that patients are cared for, cancer patients and other patients here at this hospital in the region. If you have any questions for them, I know that they would all be more than happy to answer them as well. Apologize for not introducing you earlier. Well, we will be around. Thank you again.